This morning, we are continuing the conversation, helping you better protect your kids from the most common summertime injuries. So last hour, we explained how to treat a nosebleed and the most common mistakes made when trying to stop the bleeding. We also explained what to do if your child gets his or her tooth knocked out so that you can save the tooth from dying. Now we're focusing on the 5 most common reasons that local children end up in the emergency room. Dr. Daniel Thimann is a pediatric ER doctor with Wolfson Children's Hospital and joins us this morning. Good morning, Doc. Thanks for being with us.
Good morning. Thank you for having me.
So I must admit, I was surprised to hear that car crashes is actually on this list. And I think that's just because we tend to assume that all kids are strapped into car seats. Is this an issue that parents have maybe transitioned their children too early from a car seat into a regular seatbelt, or maybe the car seat's not installed correctly, or maybe they're not using them at all?
Yeah, absolutely. I mean, car accidents are one of the leading causes of death in children. Sometimes they're improperly strapped. Sometimes there's too many kids in the vehicle. But it's very important for parents to review the car safety guidelines and put their kids in appropriate seats and restraints.
Yeah, sometimes it's just taking that extra step to reading the directions on that car seat to make sure that it's properly installed. And I'm going to tell more people about how they can do that for free, actually, coming up in just a minute. Next on the list, Doc, is dog bites. Is this just family dogs or visiting dogs? And how bad are we talking?
Yeah, dogs come from anywhere. Sometimes we hear kids are playing in the front yard and a dog comes up and bites them. Sometimes it's a family dog. Sometimes it's older dogs that have a problem seeing or hearing. Sometimes little kids, they like just to play with dogs and pull their tails, and then the dog turns around and bites them. So they do cause some injuries to children.
So this is a reminder, of course, to talk to your kids about not just walking up to a strange dog and assuming that they'll be friendly.
Absolutely.
So let's talk about falls from playground equipment, another common injury. What kinds of injuries do you typically see?
For these kinds, we usually see either forearm fractures or elbow fractures are very common. The kids tend to monkey bars. Sometimes, actually, when parents slide down with their children on their laps, that can create a lot of trauma as well. We see some femur fractures and some legs fractures for those kind of equipment.
And then, doctor, do you have advice that should that happen to someone who's at a playground with their child? I mean, should they wait for an ambulance, or should they just take them to the hospital themselves? I mean, is there something that you should know when you're looking at the injury that says, hey, I need to call rescue instead of taking them myself?
Yeah, for the majority of forearm fractures or leg fractures, it is possible for the families to bring them via their own private car. Sometimes the kids are in a lot of pain, and that can be easily assessed and treated by our very professional EMS system.
So ATV crashes, and I feel like the last time that we talked about this about 2 years ago, that this was very common because sadly we see this frequently. What is your message to our viewers about ATV crashes and their children?
Well, the American Academy of Pediatrics recommend ATVs to be used by children over the age of 16, which are not really children. I mean, these things are powerful and they can create a lot of force. We see a lot of kids that fly off, or some kids take a little joyride with their siblings and end up hitting a tree or a wall, and then they can get up being very injured.
Yeah, and for some reason, a lot of times they're not wearing helmets either, which just makes it even worse. Okay, now this is a popular one because we see them around, particularly our beaches communities, golf carts. What's the danger there? What have you seen in the emergency room?
Yeah, golf carts are getting really fast. Some of these are street legal, and sometimes the kids, 16, 17, even 14-year-old kids, take them out for a drive. They push the pedal and then they take a turn and everybody flies off. They end up with forearm fractures. Some of the kids can end up with pretty severe brain injuries as well. It just depends on how they fall.
Yeah, it's that, you're out and you're sort of in this tropical environment, you think everything's okay, but the reality is one sharp turn and it can happen. So before I let you go, and this is not on the list, but I feel like it's just imperative, to remind our viewers ahead of the 4th of July about fireworks safety. Your message?
Yeah, fireworks are dangerous. Just don't let your kids be unsupervised while they're, playing with them. Make sure you have a safety record and make sure that you keep everybody away from the fireworks. Don't let them hold them and throw them away. Sometimes they explode in your hands, and some people may know.
All right, so, it seems so common sense, but the reality is, as you know, you see it every day. Dr. Thimann, thanks for your time this morning. We appreciate it.
You're welcome anytime.
And as I mentioned at the top of the interview, if you would like to check to make sure that your child's car seat is properly installed, Wolfson has partnered with Subaru Jacksonville to offer free child passenger car seat safety checks during the first Friday of each month. So the next one is today at Jacksonville Subaru, the dealership on Atlantic Boulevard. It begins at 9 o'clock.